Hey everybody, it's Kay back again today with another question. So this one has to do with diagnostic testing. We have a 77-year-old female with a long-standing history of type 2 diabetes mellitus. Presents with acute shortness of breath, chugging along at a respiratory rate of 40 per minute. Lung assessment reveals scattered inspiratory crackles throughout. She describes feeling extremely weak for the last 4 days. The best diagnostic test to identify whether this patient has had an MI or not is it the 12 lead? A. B, CK with MB. Is it myoglobin? Or is it troponin? What do you think's the best here? Take a moment and look at this. Well, guys, the answer is troponin, because the troponin coming right from the cardiac filament structure, the basic contractile unit of the heart, troponin can remain elevated up to 5 to 7 days. So it opens up our diagnostic window wide open for us to be able to pick up on an MI days after it has occurred. Now let's look what sets this lady up for what's sometimes referred to as a silent MI. Because keep in mind, she didn't show up with any chest pain. She showed up with shortness of breath. Well, first of all, she's female. Second of all, she's elderly. Third of all, she has type 2 diabetes. And so those things are characteristic of the patients that can have an MI without even knowing it. And they come in right around this day 4 period in heart failure related to the MI that they didn't know that they had. And so here she is, day 4. She said she's been really weak for the last 4 days. Now, you might want to hop all over 12 lead EKG. The problem is 4 days after infarct, you are seeing things like pathologic Q wave. Again, the ST segment, that's back down to baseline. Maybe you can see a little bit of T wave abnormality, but that isn't going to really be your particular dead ringer sign, because she could have had an MI in that wall years ago, and it's going to show still a pathologic Q wave. And if she has an area around that infarct that is still ischemic, she can still have the T wave changes very much long-standing afterward. So the 12 lead EKG is not going to tell you that in this recent past few days that she's had an MI. CK with MB, I can tell you that's already back down to baseline in 3 days. So it's like a flash in the pan. It goes up and then it stabilizes out within 3 days. It's already back to normal. That's not really going to be of much help. Myoglobin tells you that there's, muscle damage of some sort, but it's not at all specific for the heart muscle itself. And that's why myoglobin is thought to be useful only for its negative predictive value. In other words, its ability to tell us that there wasn't an acute MI or that there isn't an acute MI in progress. So let me give you an example. You have this farmer that comes in after chores with chest pain. Now, we know that if somebody has had a lot of strenuous activity, we expect the myoglobin to go up. We would anticipate the myoglobin could go up because of a lot of strenuous muscle activity. So when the myoglobin goes up, it's like, well, all right, that tells us it's a muscle, there's some muscle damage, but we certainly don't know it's the heart. It's probably skeletal muscle. However, if somebody comes in with chest pain and we find that there's a normal myoglobin, okay, myoglobin can help us to rule out the MI, right? Because with a normal myoglobin, it's a very early marker in acute MI. If it is indeed an MI, we'll see that myoglobin go up. When that myoglobin is normal, that makes us lean more toward the side of the patient not having an MI at all. So that's what's meant by negative prognostic or negative diagnostic value. When it's negative, it's most useful to us. When it's positive, it doesn't really mean a lot. So that brings us down to that troponin, which can be elevated for anywhere from, 5 to 7 days. In some patients, even longer. So guys, I hope you like the question for today. Please head on over to my website, kayhoppypresents.com/membership. Check out my membership community and come join me there. Anyway, have a blessed day, and I will see you tomorrow with another question. Bye-bye.